Awesome, and can you tell me where you are?
I'm in a hospital room surrounded by a bed, a vitals monitor, and I see a bathroom too.
Good, and do you know what year it is currently?
Yes, I believe it's the year 2024. Time flies, doesn't it? I am starting to feel really short of breath again. Could you turn up the oxygen, please? I think I'm having an anxiety attack.
You're feeling really anxious?
Please don't worry, just increase the oxygen flow. My heart is racing and I'm finding it hard to breathe. This often happens when my anxiety kicks in. Yes, extremely. My chest is tightening and my breaths are shallow. The thought of intubation crosses my mind and it scares me. Could you stay with me until I calm down? Your presence is comforting.
No worries, so I just put on your oxygen here. I turned it up there. And I'm going to check your blood pressure and your oxygen levels, okay? I'm going to go ahead and sit you up, too.
Thank you. All right, that sounds like a plan. Just be gentle with me. My blood pressure tends to be high due to my hypertension. As for sitting up, it might help me breathe better, so I appreciate it.
I'm going to take a listen to your lungs here, okay?
Sure, go ahead. I understand it's part of the examination. With my pneumonia, my lungs might sound congested. Just let me know if you hear anything concerning.
Do you have a history of anxiety?
Not precisely a history, but lately, due to my current health issues, I've been experiencing bouts of anxiety. It's all quite new and overwhelming for me.
Okay, can you go ahead and lean forward?
Leaning forward as instructed, but it's a bit challenging with this shortness of breath. The anxiety is making my heart pound like a drum. Is my oxygen level still steady?
No, it's at 87%, okay? I'm gonna go ahead and turn it up some more.
No rush, but the knowledge helps ease my worries a bit. Thank you so much. The extra oxygen should help. My COPD makes it difficult to maintain good levels. I really hope this pneumonia clears up soon. It's been tough on me and my family.
Hi, this is Dr. Bell.
Hey, Dr. Bell, this is Will. I'm the nurse taking care of Mr. Rahul Patel today. He's telling me he's short of breath, and his oxygen started going down a little bit ago, and he's telling me he's feeling very anxious.
I see, Nurse Will. It sounds like Mr. Patel is experiencing respiratory distress. Please check his pulse oximetry and administer supplemental oxygen if necessary. Also, could you prepare him for a chest x-ray and some blood work? This will help us determine the cause of his symptoms.
Yeah, of course, I'll put those orders in. So you just want a chest x-ray, and what labs do you want done?
Yes, for the blood work, let's include a complete blood count, coagulation profile, and a check on his electrolyte and renal function panels. Keep a close eye on Mr. Patel and update me on any changes in his condition or the results of the tests. Your diligence is much appreciated.
Okay, and I saw you put an order in for lorazepam. That's okay to give him right now?
Absolutely, Nurse Will. Given Mr. Patel's history of anxiety, which can exacerbate his breathing problems, the lorazepam should help alleviate his anxiety and potentially ease his respiratory distress. However, monitor his response closely and inform me if there are any adverse effects or if his condition worsens.
All right, Mr. Patel, so we're going to give you a medication called lorazepam. Have you ever heard of it?
No, I haven't heard of lorazepam. Is it a new medication? Will it help with my anxiety and breathing? As long as it's not something that needs to be injected or intubated, I'm okay with it. My usual home medications are lisinopril, amlodipine, and an inhaler with albuterol and ipratropium for my COPD.
Yeah, so this medication's it's an anxiety medication, so it's going to help lower your respiratory demand here. So it's going to help calm you down, slow your breathing down, so that way you can get your oxygen that you need. So I'll be right back.
So this Understood, Will. I'm grateful for your assistance and explanation about the lorazepam. It's reassuring to know it will aid in calming me and improving my breathing. I'll patiently wait for your return. In the meantime, could you kindly leave the monitor on so I can keep an eye on my oxygen levels?
Yep, I will leave it on. I'll be right back, okay? All right, Mr. Patel, I have your lorazepam here. Can you go ahead and tell me your name and date of birth?
My name is Rahul Patel, and I was born on February 8th, 1964.
All right, so here's the pill, okay? Here's the lorazepam.
Guys, I feel like I am catching my breath now. Thank you so much.
Good, I'm glad that is helping a little bit.
Indeed, it's a noticeable improvement. The lorazepam seems to be working well with my other medications. It's such a relief to feel less anxious and breathe better. You're doing a fantastic job, Doctor.